Pain care isn't as simple as treating symptoms, prescribing medication, or even providing exercises. If you work in healthcare, you probably already know that. Pain is not just a physical sensation. It affects how someone moves, how they sleep, how they think, how they relate to others, and how they work, even how much control they feel they have over their life. For many people, pain is complex and extends far beyond physical discomfort. And when those broader effects aren't acknowledged or explored, people can feel invalidated or even stigmatized, even when our care is well-intentioned. That's often where the disconnect happens. As healthcare professionals, we often focus on the symptom, but the person is living with the impact. To help address this, we've developed, in collaboration with people living with pain, carers, and healthcare professionals, a pain care priorities framework to guide your assessment and management. These pain care priorities reflect what matters most to the people seeking care for their pain, to ensure the person, not just the symptom, is at the centre of care. They shift the focus from what's the diagnosis to what matters most to the person right now. And they're designed to help us with clearer consultations, especially when pain is ongoing, complex, affecting physical, psychological, and social aspects of life. Rather than narrowing in on one single dimension of pain, the priorities help organise your clinical reasoning. It's not about adding complexity, it's about providing structure. It's about making sure the person's story guides your assessment and management. Award 1 of the Open program explores these 9 pain care priorities in detail. Through case examples, reflective exercises, and practical tools, you'll build your confidence in assessing and managing people living with different pain conditions. You'll learn how to integrate them into consultations in a practical, structured way. Because when a person's pain care priorities are clear, care feels more focused for both the person in pain and for you as the clinician. Ultimately, pain care isn't about what we think is most important. It's about the person experiencing pain and what's most important to them.